Hello, everybody. Surprise, surprise. Welcome to Airway Answers, expanding your breadth of knowledge. And we're kind of doing a surprise live on YouTube, and we'll share it with everyone later. We are interviewing the amazing Katie Ferraro. She is a registered dietitian, and I'll give her bio, but I'm so excited to talk with Katie today because we're going to be talking about baby-led weaning. And this whole philosophy applies so directly and importantly to all of us in the airway field when we're talking about eating natural, textured foods, getting our babies off of these processed, pureed foods and eating in a natural way, which will help the jawbones grow. So we know mastication, chewing builds and forms bone. And most of our patients are deficient in their jaw growth. And that is one of the main factors that's caused airway epigenetic problems in the population of patients that we see. So let me talk about who this amazing Katie is. Katie is a registered dietitian and a mom of 7. She's going to talk about that. And she specializes in baby-led weaning. In 2016, she created the original 100 first foods approach to starting solid foods with baby-led weaning. Through her workshops, podcasts, courses, and digital content, she's helped tens of thousands of families give their babies a safe start to solid foods using the alternative to conventional adult-led spoon feeding known as baby-led weaning. Katie teaches families, daycare providers, healthcare providers how to do baby-led weaning safely. And her passion, and that's her passion. And she's a nutrition instructor at the University of California, San Diego Extended Studies, and a lecturer in exercise and nutrition science department at San Diego State University. She loves teaching about nutrition, food, and feeding. And while working as a dietitian specializing in infant feeding, Katie's real job is at home with her husband and she is a parent of 7 kids, all age 9 and under. So she'll talk about that because I love this. She has a singleton Molly, and she has 7-year-old quadruplets, and then she has 5-year-old twins. Katie is amazing. So she started baby-led weaning with her children, and Katie's work has been featured on CNN, Wall Street Journal, NBC News, New York Post, the Boston Globe, Fox 5, Peanut, Babylist, and tons of other places. So Katie, welcome.
Thank you, Nicole. Thank you for that nice bio. I also, Nicole failed to mention that we're actually in real life friends. I know, Nicole, we've been neighbors for a very long time since our kids were little. I remember I met you at a neighbor's house when I just had one baby, and I was like, these guys are so cool because you guys were across the street from your house. You had the baby monitor on, and I was like, wait, you're allowed to leave the house when they're still in there? And you were like, yeah, you need to lighten up. And I was like, oh, I was like, this mom's cool. You were totally laid back. You were not endangering your children, but I was like, the babies are sleeping, and we were checking on them, and we were hanging out with adults. It was great.
We had fun. And then I remember when Katie was pregnant with the quadruplets, and it was on the news, and your story is just so amazing, and how you're such an amazing mother to all these kids, where I can barely handle my 2 kids. And you got 7.
There's a lot of, I'm a yeller, which I think the airway people will appreciate. I'm really good at projecting my voice. My kids like stop yelling so much. So I'm really working on not yelling right now. So it's my Lenten goal as a Catholic mom.
Oh man. Well, I want to hear all about, I think some of our audience knows a little bit about what baby-led weaning is. Some people have maybe never heard of it, but I honestly thought of you right off the bat when I was looking on Facebook a couple weeks ago. And one really well-known orthodontist in our field is showing all the pictures of the baby-led weaning that she's doing with her 2 little kids. And I'm like, we need to get this word out to all dentists, orthodontists, people in our field. So tell us all about it.
Well, it's kind of wild because it is the healthcare practitioners who are actually doing this approach with their own babies that's really changing the narrative. Now, there is a real incredible body of evidence that supports baby-led weaning as a safe and reliable alternative to conventional or adult-led spoon feeding, right? What I call, force feeding your baby by spoon. When you see the pictures of the babies going like this, that is not a healthy, wholesome way to start solid foods. And yet over time, we've had speech language pathologists and pediatricians who are like, oh, I don't know about baby-led weaning. It sounds like they're going to choke, or it doesn't feel like they're going to get enough nutrition. And then they do this process with their own children. And they're like, oh, wait, hold up. Force feeding babies by spoons or making them suck purees out of pouches is not developmentally appropriate. And babies can eat so many more foods than we give them credit for, but we have to wait until they're truly ready. We also have to prepare the foods safely. So that's what I do in my line of work as a baby-led weaning dietitian, is to help parents, caregivers, healthcare providers, daycare providers learn how to properly prepare food so that babies, we can set them up for success, so that they can safely feed themselves, so that they can become independent eaters, that they can achieve diet diversity, and that we can avoid that like super obnoxious stage of parenting where your kids reduce down to just a few foods that they'll eat, where you're making different meals for different kids. Baby-led weaning has so many benefits, which we can get into in this interview, but it also takes a lot of pain away. So I always say I like to take just like one thing off of your plate as a parent, okay, which is having to force feed your kids or play the airplane or the choo-choo train game and fight and battle at every single meal. Because I hate to break it to you, you need to feed these small people for the next like 17 and a half years of their life and multiple times a day. So like it is worth it to do the hard work when they're babies, when they'll like and accept a wide variety of foods and flavors and tastes and textures. And baby-led weaning allows for all of that. So I just love to hear speech language pathologists, occupational therapists, our colleagues in the dental world, other dietitians embracing this approach and realizing like, oh yeah, and there's research to support it. It makes a lot of sense.
This is so great because I wish I did this approach with my kids. I have one kid who is an extremely picky eater. And when you said you don't have to make different meals for each person in your family, well, I'm doing that. And it is so difficult and frustrating. And I feel like we almost like miss that gap of like that where a child's very plastic and malleable and open when they're really little. And when you start like feeding into their specific needs and not giving them the diverse foods, they lose that ability to really even want to explore foods. What is baby-led weaning? Is it actually the types of food you're giving them, or is it that they're feeding themselves?
That's a wonderful question. I remember the first time my colleague told me about baby-led weaning. It was when my quads were in the NICU and like friends would come and help feed the babies. And I remember her saying like, oh, how's it going with your oldest back at home? And I was like, it's terrible. I'm trying to feed her solid food. She hates them. She hates me. She only wants infant milk. I'm like failing her because, you know, what kind of mom can't feed her own baby? And then what kind of dietitian mom? And I remember thinking like, how am I going to how am I going to feed these 4 babies when it's time to eat food when I can't even feed the one that I have at home? And my colleague said, well, why don't you do baby-led weaning? And I said, baby linguine? What are you talking about? I don't even know what this is. She said, oh, it's this relatively newish approach. So the term baby-led weaning was coined by Jill Rapley. She's a PhD health visitor from the United Kingdom. And what she realized, like in the UK, a lot of the work that pediatricians in the US do, the health visitors do there. They travel around and check on how the family is doing and the mom is doing postpartum, like someone checking on you to see how you're doing. Like it sounds amazing. And what she realized when babies were starting solid foods, that all of this food rejection and food refusal and the having to force the baby to eat puree so they get enough, it's not that the babies disliked the food. They disliked the feeding being done to them. And so as a philosophy, what baby-led weaning does is it supports your baby's ability to safely feed themselves from their first bites. Now you have to wait until they're truly ready, and we can talk about what the reliable signs of readiness to eat are. But Jill Rapley is the co-author of the original baby-led weaning book, which came out about 20 years ago at this point. And I remember when we were starting baby-led weaning with the quads, I was like, okay, I looked into it. I'm a college nutrition professor, and at the time I was teaching at UCSF. And my colleagues in feeding, I was like, have you guys heard about this baby-led weaning thing? Like, it sounds too good to be true because like the baby feeds themselves. And they're like, no, there's actually legit research and evidence that supports this. So we went all in on it with the quads. And it was such a more positive experience for starting solid foods. I remember my mom kind of snarking on it a little bit. My mom's a dietitian and she was over at our house in our old neighborhood where I lived by you, Nicole. And she's like, you know, these babies are eventually going to have to learn how to use a spoon. I was like, yes, but feeding is about bringing objects to your mouth, and babies do that with their hands first. And I remember her catching her on the phone a couple of days later, and she was talking to her friend like, oh my gosh, you should have seen the babies. They're eating sardines by themselves and they're eating beets. And it's like, it literally makes everyone's life easier. You don't have to make special foods. You don't have to buy baby foods. You don't have to make different foods for different kids. And this was such a transformative experience for our entire family that I actually switched the entire emphasis of my career to focus exclusively on baby-led weaning. And what happened kind of at the same time was I realized as the quads were turning 1, I just counted their foods, that they had tried over 100 different foods. And if you look at conventionally adult-led spoon-fed babies, so puree babies, babies who have been force-fed by spoon, they usually have at most 10 or 12 foods by the time they turn 1. And all feeding professionals know, once you cross over that 1-year mark, picky eating is developmentally appropriate. Your toddler is going to be a picky eater. But if you only have 10 or 12 foods and you lose those 10 or 12 foods to picky eating, that becomes a very challenging child to feed. But if you have 100 foods that your baby can eat and you lose 10 or 12 of them to picky eating, it's no big deal because you still have 85 or 90 foods the child will eat. So that was kind of when this whole idea of my 100 First Foods program was born, because we were sharing a lot on social media at the time, which I now realize is probably oversharing. But parents were like, wait, how do you get all the babies to eat these foods? And like, you don't have to buy baby food and they're eating real food, the rest of the food you're eating. So I turned this idea into a digital program, the 100 First Foods approach to starting solid foods. It's taken off around the world. It is so fun to see, parents in Singapore, parents on the African subcontinent, feeding the cultural foods that they eat, but preparing them safely and then offering to their baby and skipping over this spoon feeding phase. Like, you're literally avoiding the pain. And everybody wants their children to eat real food. It's just shoving processed baby food down their throat. The idea of commercial baby food's really only been around since the earlier part of the 21st century. It's like, or 20th century rather, but it's like, what do you think cave mama fed cave baby before there was like a whole aisle of pouches at Target? Like, babies have always eaten modified versions of the same foods that the rest of their family eats. So in a way, I feel like we're just helping parents to do the thing that we used to do before we complicated everything.
Hey guys, my name is Renata Nami and I'm the founder of Airway Circle. Are you enjoying this podcast? Well, guess what? If you become a member, you have early access to all of our podcast episodes. So run to our website, www.airwaycircle.com, and become a member today.
With commercial baby food.
It's so true. And like, even looking back, like there was a period where women weren't really breastfeeding their babies. And now I feel like there's a trend to go back and like nursing. We know it's so important. So I feel like more mothers are nursing babies now. But back in the day, that's how there was good jaw growth and development, was before the pre-industrial revolution, when foods were not processed. And now
I was thinking of you the other day. That book, Jaws. Have you read this book? It's like all about how I'm sure it's totally up your alley, but like someone sent it to me and I'm like, this is fascinating. Just sucking on purees. We're not developing our jaw strength.
Exactly. And that's exactly where we come from in our airway focus field, is that a big lack of what's occurring or what's not occurring is eating textured foods, chewing on foods. And this is literally one of the hugest factors to the decline of health in human beings. It sounds crazy, but as our jaws are not growing enough, our teeth are crowded, our airways are crowded, and everybody is developing health issues. Not everybody, but a lot of people are developing health issues from poor breathing and poor quality sleep, because our tongues are basically choking ourselves. And then that leads to an array of health issues like high blood pressure, diabetes, all these things. So if we can start young and get these kids using their jaw muscles, using their tongues, moving around versus sucking on pouches, we could probably change the outcome of health.
And this idea, I have a baby-led weaning podcast, and I need you to come on and explain this, because this is, I think like, okay, you're an SLP. I know your background. You're in the airway space, but we forget about how much is happening in the mouth, right? Like, we have, pediatric dentists on, and they're like, it's tied to nutrition. It's tied to sleep. It's tied to chronic disease development. And again, you don't want to stress parents out, because like, if you feed your baby the wrong way, they're going to grow up to have sleep apnea and obesity. But it's like kind of true. And if we can make changes and improve the way we offer solid foods, when you said, I love that you use the word plastic, like babies are this malleable form. Like, I love feeding babies, Nicole, because they do not talk back to you, right? Big kids like, I don't like your pancakes. You burned them today. Babies will eat everything. And they love you because you brought them new foods, and they're exploring it, and they're eventually going to learn how to eat it. They don't learn how to eat 100 foods overnight, and wholesome food doesn't magically appear on the table. As parents, we do have a role in making these foods. And some parents are like, I just don't want to deal with it. But it's like, hey, you got to feed this person for the next 17 and a half years of its life. So you do have to learn how to make the food safe. And an interesting thing about baby-led weaning, it's one of the few things that appeals to a second-time parent. Because like, first-time parent, remember you registered for everything and you bought like all this crap that you're like, dude, they only need like 3 things, like a diaper, a safe place to sleep, and some food. Second time parents who did force feeding by spoon with their first and have a picky eater child, they are looking for an alternative and they are willing to try baby-led weaning with the second. And they are the biggest advocates for baby-led weaning because they're like, my second or third or fourth or whatever kid eats this huge variety of foods because we taught them how to do it and let them experiment with it during that flavor window, that brief period of time when babies will like and accept a wide variety of foods and flavors and tastes and textures. So even if you feel like you've failed yourself on your oldest kid, baby-led weaning for subsequent children has been really, really transformational for families that we've worked with.
That is amazing. So when does baby-led weaning start? And you said there's a certain age we know foods are safe. Can you talk about that?
So one thing when you were just mentioning earlier, like if you think historically at, breastfeeding recommendations, right? As much as they have altered and dipped and dived and changed, like right now across the board, every major health association promotes exclusive breastfeeding for the first 6 months of life. And if you don't breastfeed, everybody knows that infant formula isn't a perfectly acceptable alternative. But the first 6 months of life, that's the point that I want everyone listening to really just put in the back of if you walk away with nothing else from these 2 crazy ladies talking to each other, 6 months of life. Infant milk, breast milk or formula is sufficient to meet your baby's needs for the first 6 months of life. So from a nutritional standpoint, and I'm a dietitian, this is my wheelhouse, your baby doesn't need anything except infant milk. So when doctors, and they do it all the time, say things like, start feeding your baby purees or rice cereal at 4 months of age, I maintain that that's an anti-breastfeeding message. You are telling mom, there's something wrong with your breast milk. There's something wrong with the way you're formula feeding. You should start solid foods early. We know nutritionally they don't need it. From a developmental standpoint, our occupational therapist friends will tell us your baby is not sitting relatively on their own until 6 months of age. And if you can't sit on your own, you're not indicating that you have the trunk strength and the core, the neck, the head and neck control to support a safe swallow. So if you don't need it nutritionally and you can't safely swallow it, we shouldn't start solid foods prior to 6 months of age. Full stop, end of story. There is no benefit to starting solid foods early. There's only the increased risk for choking. Okay. And a baby has a choking incident when they're 4 or 5 months of age. Guess what? When you bring them back to the high chair at 6 or 7 months and they're truly ready, they remember that. And then they have food refusal and then they have food aversions. Then they're in feeding therapy. And my feeding therapy colleagues, many of whom are your colleagues, will tell you the vast majority of what they see in feeding therapy in toddlerhood could have been prevented if the parents allowed the baby to feed themselves when they were truly ready. So we need to look at the reliable signs of readiness to eat. And it all starts with waiting until your baby is 6 months of age or 6 months adjusted age if they were born prematurely. So if that's a term you're not familiar with, I'll give you the example of my quadruplets were born 6 weeks prematurely at 34 weeks gestation. When they were 6 months of age, we have a common friend, Nicole, who came over to our house and was like, you need to feed these babies. And I was like, first of all, they're not 6-month-olds because they were 6 weeks early. They're like 4.5-month-olds. I needed to wait till they were 6 months plus 6 weeks. They were 7.5 months chronological age before they were even starting to sit on their own. And you can bet I was getting it in stereo. You need to feed the babies. That'll help them sleep through the night. It'll help their reflux go away. It'll help them gain weight, catch up weight. None of that is true. A baby can't use food to grow faster if they don't yet know how to eat food. So waiting until that 6 month or 6 month adjusted mark. The second one, and I touched on it earlier, but being able to sit relatively independently. It doesn't have to be perfect, but if they're slouched down and slumping down, you're an SLP, you're going to safely learn how to eat avocado if you're hunched over like this. Absolutely not. So waiting until they can sit relatively on their own. Those are the 2 most important points. And spoiler alert, most babies cannot sit relatively independently right at their 6 month birthday. It'll be 6 months plus 1 week or 6 months plus 2 weeks, or even 6 months plus 3 weeks. It is unusual to see a full term, typically developing baby who after the 7 month mark is not sitting on their own. If you got to that point, you should check in with your primary care practitioner. Do we need a referral to OT? Just is something going on? Sometimes right around 7 months, they're sitting up strong enough to then sit in the high chair and start being able to learn how to eat. But again, it doesn't happen overnight. It takes almost 6 months for babies to get proficient in feeding themselves and be able to get most of their nutrition from food. And that's our goal with nutrition, is that by 12 months of age, most of the baby's nutrition is coming from food. And that's a long way to come, because at 6 months of age, 100% of your nutrition is coming from infant feeding. So that 6 to 12 month mark, it's so crucial. But you're so lucky because that's the period when babies will like and accept a wide variety of foods if you know how to offer them and prepare them safely.
Yes. And when you said 100 foods first year, it's actually, they have about 6 months that you've just introduced 100 foods because they've only
yeah.
at 6 months.
And It works out. I'm a symmetry person. So what we do is in our 100 First Foods program, you introduce 5 new foods a week. So on Monday, we do a new fruit. On Tuesday, we do a new vegetable. On Wednesday, we do a new starchy food. On Thursday, we do a new protein. And on Friday, we do a new allergenic food. 5 new foods a week, 4 weeks in a month. So 20 foods a month in 5 months. Your baby has eaten 100 foods. And again, that diet diversity, that's what takes them into toddlerhood with ability to eat a lot of different textured foods, right? For families that eat animal foods, we're doing meats, we're doing plant proteins, we're doing high fiber, whole grain foods, not supplements, not Metamucil, not refined white carbs, real wholesome foods that are affordable, that are accessible, that give you this huge variety of like, oh my gosh, my baby can eat all these foods. It also helps the adults sometimes broaden their palate as well and try new foods. And I have 100 First Foods list that parents put on their fridge and they cross them off as they go. Because I think fruits and vegetables are important, but if you're only feeding your baby fruits and vegetables, there's no iron in there. You're missing out on a lot of the fiber. You're missing out on other nutrition like zinc. You're missing out on the protein and fruits and vegetables alone. Persons cannot live on that. So we need the whole grains and the texture opportunities that you offer when you do this, better than anyone, so much better than just having those, soft meltable carbs or the pureed foods that require absolutely no participation by the baby. And we love to help our babies, but we need them to help themselves by developing that jaw strength, and moving through 100 different foods really gives you incredible exposure to that.
Yeah, I think your babies might eat more foods than I eat. 100 foods, I'm like, oh gosh, they might have a better variety than I do. But so it's a combination. It's not just about the nutrition that's being introduced with a variety of foods, but also the mechanical aspects of the chewing and the swallowing and the different textures. So what does that look like? Like when the baby is about 6 months old, they're ready to sit up. You kind of feel like you have the cues to start baby-led weaning. What does that first day or whatever look like?
It's brutal because they don't really eat anything, right? And that's typical. So my Instagram is Baby Led Wean Team, and all we do is make reels all day long of like, this is what it looks like when babies are sitting up. Here's how you safely prepare the foods. But also, spoiler alert, they're not going to eat that much. And parents will get discouraged. Like, I made lamb on day 4, and I made this beautiful lamb leg, and it was soft and shreddable, like you said, Katie, and had all the low sodium broth for extra moisture to help them swallow safely. And they just splashed around in the mat with it. Guess what? Learning how to eat is a full sensory experience. Getting messy is actually part of the experience. They need to touch it and smush it and taste it and smell it and stick it in their ear and in their hair. And eventually they bump into their mouth and they get in there. Oh, that tastes different. Oh, that's different. And this SLPs, you guys know about the munch chew and then the rotary chew and then moving the food to the back of their mouth. It doesn't happen until they've had lots of experience even getting it to their mouth. And so in our experience, we found that it takes most babies about 8 weeks before they get the hang of feeding themselves. And this is in offering solid foods 1 to 2 times a day. So if you're just starting solid foods or you're counseling families who are, my suggestion is 1 to 2 times per day, about 20 minutes. That's typical. And the goal is not to get enough nutrition in the baby. And my dietitian friends, we're like so type A. And all we worry about is, oh my God, the baby's not getting enough nutrition. Yes, they are. The baby is continuing to get the majority of their nutrition from breast milk or formula, especially during those crucial first 8 weeks when you're like, oh my gosh, nothing's happening. Yes. Every single day, they're making micro steps of progress to pick the food up, to smush it, to use their whole hand, their palm or grasp, to rake and scoop the foods up. In baby-led weaning, we don't cut the foods very small. That's a choking hazard. A 6 and 7 month old baby who doesn't have their pincer grasp can't pick up small pieces of food. And even if they did and got it in their mouth, because mom puts it in their mouth, that very small piece of food, that's the exact size of food that could potentially occlude their airway. So we do the longer pieces of food shaped about the size of your adult pinky finger. The baby uses their whole hand or their palm or grasp to rake and scoop the food up and put it into their mouth. Putting anything in a baby's mouth, including a spoon, can be a choking hazard. So we have to prepare food safely, position the child safely in the high chair, and make sure that they're really ready to start solid foods. And even when you do, it's real slow, but you stick with it for 8 weeks. Parents always come back and they're like, okay, you were right. At about the 8-week mark, it all started to click. Then you're dropping a milk feed. Then the baby bumps up to 2 to 3 times a day. Now they're trying all the different textured stuff and they're moving it around their mouth and they're starting to swallow some of it. And you're noticing, oh my gosh, less nutrition from milk, more nutrition from food. That's what weaning is, but it doesn't happen overnight. Okay. And you get that 6 month, I call it the runway Okay.
Mhm.
I call it like preseason, and my husband's like, please stop making sports references. You're terrible. But like, remember like when the Chargers were in San Diego and you'd buy season tickets, you'd always like get the season tickets to the preseason and you go watch it and be like, oh my God, this is like so ugly and terrible. They shouldn't even call this football. That's what 6 to 12 months is for learning how to eat. It's like, it looks like nothing's happening, but they're practicing and getting better so that when the season opens, when your baby turns 1, most of their nutrition can be coming from food.
I like that. I totally get that. The preseason practice
Thank you.
time, midterm 1. Tell your husband he's wrong, because that is so great. And I love how you talk about sensory experience. Okay. So we're talking whole body in terms like PT, physical, core strength to sit up. We're talking about fine motor of the hands, oral sensory motor. And in one of your podcasts, you have the best podcast too. We got to talk about that at one point.
Thank
I think
you.
everybody should take a moment. What is your podcast called? Can you tell everyone?
Baby Led Weaning with Katie Ferraro. It's blwpodcast.com. And it's a little insane. We're over 450 episodes at this point, but it's like, there's so many little teaching points to talk about and people love it. So it's a great source of information if you're interested in learning for baby led weaning, and it's all free.
It's so good. It's free. And not only does Katie talk all about her programs, different ideas, there's tip of the day, all this stuff, but you also interview all these other amazing people, OTs, PTs, SLPs, it's MDs, all different people. It's so great. One of your podcasts, you talked about how when the babies start, the food might, like milk or whatever, might drip down the side of the mouth. And when you start introducing like liquids in open cup, I think I was listening to the open cup drinking one. Mm-hmm. And the tendency is like to want to wipe it off. But no, it's really important for the liquid or the food to remain on the mouth so the baby gets that sensory experience, right? Can you talk about that?
Well, and it's the SLPs who are so important in this field. So one of my good colleagues is Dawn Winkleman. She's a speech language pathologist. She's on social media at Miss Dawn SLP. She's also the feeding expert for the feeding gear company Easy Peasy. So I work very closely with them. I know a lot of SLPs, OTs will use their products in feeding therapy. But they're also great for babies who are starting to learn how to eat solid foods. Suction, silicone, 100% silicone, mats and bowls, appropriately sized utensils instead of like, a baby spoon that has a long handle and a big old bowl. Like that's not appropriate for a baby. Short, fat, round handle, a very small bowl that doesn't cover the entirety of the tongue and basically cut off, all the SLP stuff, the airway stuff. Like we need to have the right tools. And so Dawn, who developed the tiny cup, we both used to use plastic shot glasses for open cup practice because there wasn't a good baby led weaning cup. So they developed the tiny cup from Easy Peasy. It came out in 2018 and it's a 2-ounce cup. So we help babies practice drinking out of the open cup because we want your baby to go right from the breast or the bottle to an open cup, right? You can skip the sippy cup. And one of our most downloaded episodes is called 6 Reasons to Skip the Sippy Cup. And SLPs love it. Dentists love it. Dietitians love it because sippy cups were designed by parents for parents. All they do is prevent spills and nothing else. It's not developmentally appropriate for your child to gnaw on a plastic top. Like I know your baby knows how to swallow liquids. We're working on having them eat solid food. So this open cup practice and, letting that milk dribble down the side of them, that feels gross, right? To have like milk in your neck folds. You guys have all experienced this with your own babies, but like that sense of discomfort, next time they go to pick the cup up, they make a slight micro correction so that the milk eventually doesn't dribble down the side of their mouth. Ideally, your baby can be drinking out of an open cup on their own with no assistance, albeit with minimal spillage by 12 months of age. So we encourage families to start open cup practice around the 6-month mark. I know you have a million things to do as a busy parent. It's just 5 minutes of open cup practice after meals starting around 6 months of age. We start with thicker liquids, which are safer and easier for your baby to swallow because they're used to the thicker consistency, like breast milk and formula. If you start with water, which parents love because it's not messy, water is a thin liquid. And water can cause babies to gag excessively. And a little bit of gagging when you start solid foods is very typical. But we don't want to make the baby gag by trying to force them to drink a thin liquid that, by the way, babies don't need free water because they get their hydration and fluid needs from infant milk. But we also don't want them to gag excessively because then they'll start to have negative associations with food and feeding and drinking. So we start with those thicker liquids 5 minutes a day with the goal being of drinking out of an open cup independently, albeit with some spillage by age 1. And it really helps cut back on excess milk consumption because talk to any mom or parent caregiver of a 1-year-old. The 2 biggest problems are milk and snacks. Kids that are full of milk, allowed to drink 30, 40 ounces of milk. But parents are like, milk's good. Well, they have little tiny bellies. And if they're constantly full of milk, they're never going to experience what I call the casual hunger that they need at meal times, right? We want our kids to feel a little bit hungry when they come to the table. That's what freaking makes them eat the food that you've so lovingly prepared for them. And then the snacks are the other problem, like constantly grazing throughout the day and never allowing the child to experience that casual hunger completely sabotages mealtime. So open cup drinking, parents are like, oh my gosh, but they drink so much less than out of the bottle. Yeah, duh, that's the point. So they drink less milk and get more nutrition from food.
That makes sense. And it's exactly in line with our line of thinking. At 6 months is when you introduce open cup drinking. Skippy the sippy, right? No sippy cups. You had a podcast about that 360 Wow Cup, which we do not believe is good either. Not just based on, well, mostly based on the mechanics of how the child needs to suck. We want to eliminate.
I'm an adult and I can't figure out how to drink out of that thing. Like, yes. But you know what? It always says it's dentist approved and parents find it at Target. How could they possibly sell this at Target if it's not appropriate? Like almost all of the feeding gear they sell at Target is not developmentally appropriate, just so everybody knows.
Yeah. When I realized all of this stuff and started looking only for free flow bottles, even for my kids now, elementary school age, whatever age, at a young age, we want all drinking to be free flow with no sucking required to get the liquid out. Well, the Wow Cup or that 360 cup requires sucking, but I go to Target and I'm in there looking at all the water bottles that they make for any age, even for adults. Everything, 99% is sucking. You need to suck to get the liquid out. Well, that damages, it overworks the cheek muscles, can narrow the palate. So I have a whole picture list of different water bottles that are free flow, that are appropriate for like myofunctional purposes.
I need to get that from you. I know, because these kids drinking out of, these kids at school with the Stanley cups and the straws are this long. You can't even hold your breath for that long when you're like 2 and 3 years old and they want to drink out of these long freaking straws.
And they're chewing on them, and then the straw's going on top of the tongue, promoting low forward tongue posture. And, you know, we should be swallowing with the tongue up on the palate. So, yeah, so I love that small open cup that you talk about. And in that podcast, it was a really great analogy. She said, you know, you want the baby to wrap their hand around the cup without having handles. And I think it was Dawn who related to, like, when you go to drink your coffee, what if you had 2 handles on your coffee cup and now you're trying to drink your coffee with 2 handles? How do you expect a baby's going to drink? I'm like, oh my gosh, I don't think I'd be able to drink my coffee if I had like a double handle.
I know.
It's like,
wait. Think about the 360 cup, right? Same concept. I remember getting that from Target being like, I guess this is what my oldest drinks after a bottle. I don't know. Like they sell it at Target. Like they've like conditioned and trained me to be like, this is next. Like, no, it's not. Like you can skip the entire pouches aisle, all the baby food. You don't need it. But with the cups, you have to push the top of that down with your upper lip and then suck with your lower lip. That is not the mechanism that we want babies learning. And at the same time, parents are like, well, I'm also trying to do open cup drinking. I was like, this is so stressful to your baby to try to learn like 4 different ways to drink. Like, keep it simple, stupid is like just for me. But I love the easy peasy feeding gear because it's so simple. And it's like, this is appropriately sized for your baby's age and stage. And I do love that they have an SLP, a feeding expert who designs their products because they are very thoughtfully and intentionally designed, where most of the stuff in the feeding space is like made out of crap materials and developmentally inappropriate.
Yeah, a lot of plastics. So at what point are utensils introduced in baby-led weaning approach?
So great question. There's no fork milestone for babies prior to 12 months of age. So whenever you see a little set that has like a baby fork in it, forget about it. They're just selling you crap you don't need. Some of these products, they say they have a choke guard on it. There's absolutely no data to support that idea. Your child will use their hands to learn how to eat first. As far as spoons go, you can start introducing a spoon as early as 6 months of age. And a lot of times people mistakenly think that baby-led weaning just means skipping purees. It does not. Purees are a very important texture for your baby to master. It's just not the only texture they can eat. So we can honor the self-feeding principles of baby-led weaning and still offer naturally pureed foods like oatmeal or full-fat whole milk yogurt, unsweetened applesauce. And we do that using the pre-loaded spoon technique. That's a term that Dawn Winkelman coined. So I want to give credit to her as an SLP and a baby-led weaning expert. The preloaded spoon approach, you dip as the caregiver the food in the baby-led weaning spoon. You put it in your baby's hand. You do their hand underhand approach and gently guide the spoon to their mouth. They get the hang of it very quickly. You guys, your babies have been watching you eat for the first 6 months of their life. They figure out what it's supposed to do. And then the next step is you preload the spoon and you lay it on the side of the suction mat or bowl. And the baby goes with their whole hand. Palmer grasp picks up the short, fat, round handle of the baby-led weaning spoon and brings it to their mouth. And then around 8, 9, sometimes 10 months of age, babies will start dipping and scooping on their own. And then as you roll into the 12-month mark, that's when we introduce the fork, is starting at 12 months of age. So focus on the spoon from 6 to 12 months of age. Most babies are bringing the spoon, doing their dipping and scooping pretty proficiently by the time they turn 12 months, but not if they haven't been allowed to practice. So practice makes progress, and letting your baby experiment and explore with the spoon, knowing that they're not going to be super proficient at 6 months of age. But a lot of babies who start at 6 months of age, when they're showing those other reliable signs of readiness to eat, by the time they're 9, 10 months of age, they're using the spoon pretty proficiently. They're drinking out of an open cup, and they've turned the corner now where most of their nutrition is coming from food as opposed to milk. They're rolling into that 1 year mark with the goal being to get most of their nutrition from food. And that's when we can wean off of formula and onto cow's milk, or continue breastfeeding beyond 1 if you'd like to. But just acknowledge that at the 1 year mark, most of baby's nutrition can be coming from food, and milk provides just a small amount of that.
That's a great summary. So that 1 year football feeding season starts. Like they're ready.
That's right.
Season work. Okay. So a lot of us work with special needs kids, right? Kids with tongue tie, lip tie, Down syndrome, low tone, all these other issues. Can you talk about how baby-led weaning plays into those children's development?
100% the adapted baby-led weaning approach. I highly encourage you to check out the work of Jill Rabin. She's a speech language pathologist out of the Illinois area. She coined the term adapted baby-led weaning. When I started in baby-led weaning, I remember there were lists of, here's all the conditions or diagnoses where baby-led weaning doesn't work. I have personally worked with, as have my colleagues, every single one of those conditions, with the exception of a fully tube-fed baby. There is no condition in which a baby cannot learn to feed themselves. And Jill Rabin, part of her adapted baby-led weaning approach, is promoting this philosophy and doing it with research and doing it with credentialed feeding experts to show that all children can and do deserve the right to learn how to feed themselves and do not need to be force-fed. So the adapted baby-led weaning approach, ABLW, Jill Rabin recently wrote a book. She co-authored it with Jill Rapley, the co-author of the original baby-led weaning book. Jill Rabin, for sure, is the leader in adapted approach. She works primarily with babies with Down syndrome. And so she talks and educates and teaches a lot about how the timeline might look different, but there are also some other nuances for helping these babies learn to feed themselves. It's not just simply, delay, and then they'll figure it out on their own. We know that that's not true, but she has some amazing approaches. So I would defer to her. I have a couple of interviews with her, but she's, again, online, Jill Rabin, Adapted Baby-Led Weaning, and the Adapted Baby-Led Weaning book is a fantastic resource. It's very cutting edge and new too, because we need to stop perpetuating this idea that certain types of babies with certain disabilities or diagnoses can't or shouldn't be allowed to learn how to feed themselves. All babies deserve the right to learn how to eat, but we need therapists who are certified in this. So I'd really encourage you to look into Adapted Baby-Led Weaning and Jill Rabin if you have the opportunity to.
So I listened to one of your podcasts recently with Jill Rabin, which was great. So again, everybody, you've got to download Katie's podcast on baby-led weaning and pick whatever topics. There's 450 podcasts.
I'll send you the ones about adaptive, because I think for your audience, that really is the most important. I work primarily with typically developing quote unquote normal nutrition, but I have covered every single condition possible that used to be on that list: cleft lip, cleft palate, Down syndrome, babies with cerebral palsy, babies that have had, lip and tongue and cheek ties. There are some adaptations, but we can't just say, they need to be force fed by spoon in order to get their nutrition. That's not true. That's honestly lazy.
Yeah, they need it more or just as much, because if there's low muscle tone or decreased mobility of the tongue, it sounds like this approach will need to be modified in certain ways by a therapist, with a guiding hand. But those are the ones that are going to need that extra muscle use, movement. We don't want to deprive them of the ability and the opportunity to strengthen their oral facial muscles by not giving them these types of foods. So your podcast with Jill Rabin was really great. And she talks about lip and tongue tie on there, which a lot of our population works with patients who have lip and tongue tie. And she covers a lot of that. And she says her and Jill Rapley have been now lecturing all around the world, and their book is translated into Portuguese, or I forget what other language.
It was like Polish the other day when I was talking to her, but it's so important too, because actually I did an episode with Jill Rabin, who I'm friendly with, and actually met her in person the other day in San Diego, which was cool, because you're friends with these people online for years. You're like, we never met in person. I know I should have called you. I didn't think about it, but we were talking about. She came on the podcast to talk about why speech language pathologists don't believe in baby-led weaning. It's this old idea. And it's not the younger, not to be ageist, I'm older than probably most of the people that have young babies. The younger generation of SLPs are like, hold up, there's a real incredible body of evidence that supports this approach. I'm going to try with my own babies. And then they're like, oh, well, in SLP school, they taught us that like it increases choking. Well, here's all the research that shows there's no higher risk of choking when you start solid foods with a baby-led approach compared to conventional adult-led spoon feeding. But here's the kicker. That only holds true when parents are educated about reducing choking risk. And so that's our goal as credentialed professionals. You can't leave it up to TikTok and Instagram. I mean, we're all there to promote our messages, and that's where parents are learning, but there's so many unsafe feeding and food preparation methods and messages being put out there that do increase the risk of choking. But the research shows us if parents are educated and learning from the right resources, there's no higher risk of choking.
So if someone wants to start a baby-led weaning approach, which it sounds amazing. This sounds like what we should all be doing with our babies. Should they be guided by a registered dietitian or someone? Are you certified in this approach, or how do we know how to help we guide them?
You should always look at where you're getting your food and nutrition information from. The registered dietitian is the nationally recognized credential, the only one in the United States that indicates that practitioner has had the requisite amount of scientific background. This is science, nutrition science. As a dietitian, I'm a practitioner of food. I have a credential, I have an undergraduate degree. I also have a master's degree, but dietitians now, as of this year, following in the footsteps of SLPs, actually are required to have a master's degree. And I have had advanced training in pediatric food allergies and a lot of the baby-led weaning stuff. You start doing it with your own kids and then you realize, wait a minute, there's really no rules about this stuff. There's no certification. So I call myself a baby-led weaning dietitian. There's no certification for it yet. It's something that we're definitely working on. But for just a blogger or a mom who's fed one baby, I mean, I see so many unsafe things. I really, like for my own mental health, have to unfollow so many people just because I'm like, that's not safe. You're going to choke the baby. And then I can't help myself. I want to help them. So I would highly recommend that you do seek the help of a registered dietitian. Also SLPs who are feeding therapists. So if they've had advanced training in infant feeding and they're a feeding therapist, many of them are pro baby-led weaning at this point. And occasionally you'll come across an occupational therapist who also has training in infant feeding and maybe a feeding therapist. But my thing is like, babies shouldn't have to be in feeding therapy for parents to learn about this. So my goal is to bring baby-led weaning as a evidence-based approach to really elevate Jill Rapley's message. Jill Rapley is what I call the founding philosopher of baby-led weaning, right? She put out what it is and why it's better. My goal is to show parents how to do it safely. So if you're interested in this approach, a great place to start is a free online video workshop I have. It's called Baby-Led Weaning for Beginners. It's 75 minutes long, but it walks you through all the ins and outs of what's safe, what's not, what to do, when to start, what to look for. And I give everybody on that free training a copy of my original 100 First Foods list. So you'll never run out of ideas of foods that your baby can eat. You can sign up for all of that. It's via my website, babyledweaning.co. I'm also on Instagram at babyledweanteam.
Baby-led wean, what was for the Instagram handle?
Team. Baby-led wean team. Because we're here to help you. We're all in this together. You got to feed kids. Let's work with the babies to start them out on the right feet.
So someone maybe watches your video, downloads your 100 Foods, your book. Should they also work with you directly or work with a registered dietitian who is trained in baby-led weaning directly, or they can just do this on their own just by kind of following
on their own? I have a program called Baby-Led Weaning with Katie Ferraro. It walks you through the 100 First Foods, shows you how to make them all safely. We have a 100 First Foods daily meal plan because some parents are like, can you just tell me which food to feed in which order? It's 20 weeks of meal plans. It's all there for you at babyledweaning.co. But whatever you do, I do encourage you to get your food and feeding information from credentialed professionals who are trained in this approach.
So exactly. So, okay, this is amazing. Tell me once more, Baby-Led, the website.
Our URL is Baby-Led Weaning, and it's LED. It's not Baby-Led Weaning, babyledweaning.co. Everything is linked up there that you need. And that free workshop is Baby-Led Weaning for Beginners. And I also have a paid program if you're interested in learning how to actually make all of the food safe.
This is so amazing, so awesome. I am so excited to air this, show this to everyone and have them.
Thank you. And thank you for, we need to collaborate, right? No one profession is equipped to help your baby safely start solid foods, right? You need to know the airway stuff. You need to know the jaw development stuff from the SLPs. You need to learn the food stuff from a dietitian, the postural support and the crossing midline and the sitting up from an occupational therapist. So I love this collaborative approach. And I am really interested in learning more from you about chewing and jaw development and how we can incorporate textures to help babies do this so we can prevent so many of the things that you guys see in your population in the airway space.
Yeah, this is so great. Well, we'll probably have to get together and do this again like a few times because I even have more questions for you. It's so interesting. And I wish looking
Well, the
back, I
problem
could
with you and me is that we can talk forever. So we will probably have to do it again.
totally. But honestly, like, I feel like I wish I did this approach with my kids and I didn't. And there's like a little bit of guilt, but now I'm like paying for it because now I'm like, you only eat chicken nuggets, like to one of my kids, you know? And it's like, you know, so I want to spread this message to other people, younger parents who, you know, or our therapists who can help patients learn these, you know, different
Well,
ways
thank
to
you
eat.
so much for covering this topic. I appreciate it. It was really great to chat with you.
Thank you. Have a great rest of your day. I appreciate it. Take
Bye,
care. Okay.
Nicole.
Bye.